earlier diagnosis and faster treatment are just two of the things being promised as part of the government's 10-year cancer plan, which is announced this morning.
Yeah, ministers say the measures will help close the gap between England and other comparable countries. Let's have a look at some figures then. So the aim of this plan is to ensure that 3/4 of patients are surviving cancer for at least 5 years by the time we get to 2035. That target hasn't been met since 2014. Yeah, the government has also pledged to deliver 9.5 million more tests and scans by 2029. And to meet all cancer waiting time targets by the end of this Parliament. Now, currently, only 3 out of the 121 NHS in England are meeting those targets. Well, we're joined now on the sofa by Professor Pat Price from Radiotherapy UK. Good morning. Thank you for coming in. I mean, every single family in the country will be affected by cancer, will know somebody who's affected by cancer in some way. How big a deal, potentially, is this plan the government's unveiling?
This is really important. I think the fact that we've got a plan is great. I think all credit to Wes Streeting. I think we'd lost our way a little bit in cancer, and he's absolutely in there. We've got to be. And I think he really means it. You rarely meet politicians, but if they've been affected by cancer or touched, like him, Jeremy Hunt, they really mean it. So great he's leading on this. Great the Department of Health have done a survey of 11,000 wrote in, obviously weren't happy, and sorting it out. So the fact we've got a plan, great news, up the agenda. However...
I was sensing a bump.
Yes.
Yeah.
I think lots of good in there, lots of little things like you can have your app and get your screening appointment. Yes, all that. But the elephant in the room, as you've said, is those targets aren't being met. We know it's speed. You have to get your treatment on time. And the data is appalling. It is the worst cancer crisis of a lifetime. Still, I've been on this sofa every year for the last 5 years saying it, and it's still really bad. And the thing is, it's sort of going to get worse. 30% increase in cancers over the next few years by CRUK. The workforce is on its knees. We've got also the NHS itself is in crisis, and costs are going up. This is a monumental mountain to climb. It's as though Wes has really got everybody at sort of every space camp, but now we've got to do the big thing, which is there.
And other countries do seem to be doing it better.
Oh, yes.
I mean, we are lagging behind. So what is it that we've been doing or not doing in England where other countries have been doing?
I think Denmark is the classic example. They started 20 years ago, same place as we are. They are rocking it. I think the 3 elements there was, number one, they had continuity of plans. Every 5-10 years, they built on the next, built on the next, built on the next. Secondly, they absolutely prioritised the 62-day target, almost put it in law. You had to have your treatment in that time. And they invested in clever things, like, in fact, they invested a lot in radiotherapy. So that's why they did it. We should have done that.
So they're calling this a 10-year plan.
Yep.
But it sounds to me from what you're saying is that even 10 years isn't necessarily long enough to make the radical changes that so many people would want.
For patients now, and also the workforce who are really looking to this to turn something round here, we have to start like today, because we've been saying these targets are going to be met next year for the last 6 years. Suddenly, we're going to make them in 3 years' time, are we? Radiotherapy, for instance, my own area, which is needed in 40% of cures, the target, now it's only 40% get their treatment on time. How in 3 years are we going to get that to 85%? No new money, no expansion of workforce, no investment in kit. This isn't going to happen. But having said that, the workforce, we've presented a whole plan how to do it with the workforce. Neat ways of increasing efficiency, productivity, widening access, all these sorts of things. Not much cost. But unfortunately, that didn't make it into the plan.
And you talk about no new money. We were seeing a report earlier on looking at this amazing equipment that could come in and speed things up, but it's expensive.
Relatively expensive. A new whizzy radiotherapy machine that can treat people faster, accurately, precise, top of the range, world class, £2 million. That sounds a lot. they last 10 years. They can treat 700 patients a year. If you said to somebody, for £250,000 a year, you can treat 700 people, you'd grab it. So it's just, is the money in the wrong pots? Is it not being used there? So that's why we need to cut through this bureaucracy, and we've always done it this way, and smash it, just like we did in COVID. Say, no, we don't do it that way. That's a blocker. We're going to change it. And it's only if you have that level of just change it, do not keep doing what you're doing and make it happen, then you can do it. You've got world-class staff here. Don't lose them now.
I can really sense your frustration on a day when we are thinking about the future, and there's a lot you're happy about. You are still,
yes, absolutely, absolutely, yes. And of course we want good news stories in cancer. But we've got frontline staff who've got these patients now that are getting, you know, the Department of Health admit it themselves. Macmillan were on your sofa on Sunday. People are not getting the care they want. So, of course, we feel absolutely passionately about it, and we've got to do something about it. And the frustrating thing is we can, but how do you cut through bureaucracy? You know, England, we should be able to deliver cancer patients with treatment on time. Is it that difficult?
So in about 5 minutes' time, we're going to be speaking to the Health Secretary.
Good.
Clearly, you're welcoming the cancer plan. Anything
Yes.
that's going to improve things is good.
Yes.
But what's the one thing that you'd like us to ask him?
I would like to ask him, actually, I did have 2 minutes with him on Monday night. I would ask him is to, yes, we're behind you. We need to get this implementation, but get the clinicians in. We can tell you things you haven't been told, and we've got solutions. We need to get rid of the blockages. So please, please, please see us. Hopefully he's penciled us in, but soon as possible. Today would be good. Yes.
So what does that mean? Does that mean that he obviously talks to loads of people, but are you saying he's talking to the managers and the administrators rather than to the actual doctors when he's coming up with these plans?
He's doing the great bit. He's getting the leadership and he's getting the vision, and he really cares. That is so important. But we've got to fill in that bit now that says, OK, the NHS has its certain way of doing things. You have to cut through this. He's got to be bold and radical and do it. He can do it, but if he sticks with the normal way we do things, I'll be sitting on this sofa every year for a long time.
Professor Pat Price, thank you very much indeed for coming in.
Thank you. Now, today marks the 30th